Don't like that. Weird angle, I totally agree, but my air conditioning's not working upstairs, so we gonna make it work. Okay. Hi guys, welcome back to my channel. We are finally covering a true crime case. And of course, it's a disturbing one, so I want to just put a disclaimer out there. We're going to talk about unborn children today. We're going to talk about women at risk. We are going to talk about a variety of things that could be triggering to you. And so for that reason, if you decide not to join me on this journey, it's no big deal. Click on one of my other videos. Go look at one of my other numerous ones on my playlist. Before we get started, if you haven't done so already and you enjoy true crime and books apparently, because that's what I've been posting, go ahead and hit that subscribe button and ring the notification bell so you don't miss out on any videos that I post. I've been posting weekly because I'm a badass bitch. But let's go ahead and get started. Today we're going to be discussing the disgusting crimes of Kermit Gosnell. Now, Kermit was born on February 9th, 1941 in Philadelphia, Pennsylvania. He graduated from Dickinson College and then went on to attend Jefferson Medical College, where he received his license to practice medicine. He was fairly outspoken in regards to abortion rights in the 1960s and 70s, and in 1972 he opened the Women's Medical Society in Philadelphia, Pennsylvania on Lancaster Avenue. Specifically, if you're not familiar with Philadelphia, this was located in West Philadelphia in a community known as Mantua. At that time, he had also started a halfway house for individuals who were struggling with drug addiction, and so this was to serve as sort of a rehab center for these individuals. Now, Kermit was pretty well known in the community for his outreach and his work with impoverished populations, and so everybody thought that this guy was a pretty decent human being. The Women's Medical Society was a facility that marketed itself as helping impoverished, low-income women. Now, it offered general women's services as well as abortions to women in the community, and these women were specifically low-income, underserved women. By the late 1980s, tax records, however, reveal that Kermit had gotten himself into quite a bit of debt. And while you might think, okay, what is going on here? It actually created for him this narrative where he was the perfect martyr. He was going into debt to help impoverished people, and nothing says glowing citizen than using your own money to help people who are of low income and who are at risk. But as you start to delve a little bit deeper into his past, into his facilities, and into his practices, the narrative becomes a little bit darker. In 1989 and 1993 specifically, Gosnell was cited for having no nurses in the recovery room at his facility. In 1996, he was fined for having unlicensed personnel employed at his facility. This means that staff who had no medical background, no medical training, were not only treating, but were medicating pre- and post-operative patients. In the year 2000, a lawsuit was brought against Gosnell on behalf of deceased Shamika Shaw. Shamika had passed from a perforated uterus and bacteremia just 3 days after having received an abortion procedure from Gosnell. As stated in the claim, Shamika had actually called the Women's Medical Society where she had received the abortion just 24 hours after having the procedure and stated that she had increased heavy bleeding. And while she had made this phone call, she had never received any advice to seek further medical attention. In 2001, Gosnell received a host of fines for storing vaccines at the wrong temperatures, in unsanitary conditions, and for not maintaining any logs as to who or what vaccines were given. Now, these are just some of the lawsuits that Gosnell faced over his career. In total, he practiced for 32 years, and he received a total of 46 citations, fines, or lawsuits over his career. In 2010, a months-long investigation was conducted into Gosnell and his practices. The investigation involved the FBI, the Philadelphia Police Department, the DEA, and the Dangerous Drug Offender Unit. The investigation and then the raid that occurred following the investigation was based on claims that the facility was taking part in illegal drug practices. This investigation also revealed new information in regards to another citation or investigation per se on the death of Karnamaya Mangar in 2009. Because of this specific information, the Department of Health and the Department of State were both present when the raid occurred at the Women's Medical Society. Now, when detectives entered the facility, it was described as deplorable. Absolutely the worst conditions that the detectives had ever seen in their entire lifelong career. The actual document that describes what they saw cites flea-ridden feral cats wandering throughout the facility, feline feces scattered throughout the stairwells, individuals who were waiting for their abortion procedure or who had just come out of their abortion procedure sitting around in broken down recliners covered by blankets that were bloodstained, and overall the facility just smelled of stale urine. The women who were waiting for their procedure had just been sedated by non-licensed staff, meaning these individuals had no idea the medications that they were giving, and they had no idea the dosage that they should be prescribing. There were no records to support the doses that were given or the medications that were given, and specifically when the medical staff, and I use that phrase loosely, were asked what medications they had just given their patients, they were unable to tell them the dosages or the medication names. And perhaps the most disturbing, fetal remains were found throughout the facility, stored in disgusting areas and containers such as milk jugs, old orange juice containers, and cat food containers. Now, I want to make a little interjection here because I know somebody's going to say, why would anybody go to this facility if when they walked in for their procedure, this is what they were walking into? But I want to make it very clear that these women were not only low income and underserved, many of them were immigrants from other countries. And so specifically, Karnamaya was an immigrant, I believe, from Haiti. If not, I'll put it right here. But my point in saying this is that most of the women who were getting procedures at this facility, not only could they not afford a procedure at another institution, but they likely didn't have the resources to seek out those opportunities. And therefore, Kermit Gosnell was taking advantage of these women and their circumstances. At the time of the raid, Kermit Gosnell admitted to detectives on site that about 10 to 20% of the fetal remains that they found were older than 24 weeks of age. And this is a big deal because in the state of Pennsylvania, 24 weeks is the legal age limit of which an abortion can actually occur. In some of the fetal remains, obvious surgical incisions had been made at the base of the skull. Now, this means that someone had intentionally cut the spinal cord at the time of the abortion. In total, 45 fetal remains were found at the facility. Experts believed at that time at least 2 of those remains were of children who were actually born alive and would have been able to survive had they not been intentionally murdered. Obviously, the raid resulted in an immediate suspension of Kermit Gosnell's license to practice, and the facility was shut down. Gosnell was officially arrested on January 19th, 2011. He was charged with 8 counts of murder. Prosecutors had enough evidence to show that 7 babies had been born alive and that Gosnell had actually used scissors to snip their spinal cords. The 8th count was for the death of Karnamaya Mungar from 2009. Gosnell's wife, Pearl, was an employee of the facility, disgusting, and she, along with 8 other employees of the facility, were arrested and prosecuted for numerous charges. Gosnell, along with 7 of those employees, were charged with 23 counts of drug conspiracy. These charges were based on women who had received extremely high doses of painkillers with no apparent reason. On the count of 3rd-degree murder in relation to Karnamaya, prosecutors alleged that staff had given her a lethal dose of anesthesia combined with painkillers. In regards to the 7 counts of murder, which occurred to the children who had just been born via an abortion procedure but who were alive, staff were able to testify that they had actually seen the children move or heard them cry before they had had their spinal cords cut. Now, Stephen Massoff was a clinic employee, and he was one who had received his medical degree but did not have a license to practice. Most often, this results from individuals who go to 4 years of medical school but then never go on to do a residency program, and therefore they are not licensed to practice. But I'm getting off track. Stephen Massoff had actually testified that it was common standard procedure at their facility to actually cut the spinal cords of the babies that were born via abortion procedures. He testified that he himself had probably cut the spinal cords of at least 100 babies. Now, obviously, prosecutors had experts testify on this case, and they stated that this is in no way a normal standard operating procedure in abortion procedures. of these 7 counts of first-degree murder, a picture was actually found of one child who had been killed. Experts believe that this child was actually 30 weeks old when it had been born. Now, I'm not going to individually list all of these people who had actually been prosecuted and charged. I will go ahead and put up a picture here of those people, but it can get a little confusing when I start rattling off individual names and their individual charges and the times that they received. But I will put a picture up here, and I'll actually leave a link in the description box so you can click it and look at that if you so desire. But what I can tell you is that among the cesspool of creeps that were prosecuted in this trial, nobody outside of Kermit Gosnell received more than 5 to 10 years in prison. After all was said and done, Kermit was convicted of 3 counts of murder, 1 count of involuntary manslaughter, and 200 lesser counts of infanticide and racketeering. After the trial, he struck a deal with the prosecution so that he did not receive the death penalty, and he is serving 3 life sentences without the possibility of parole. There are a lot of details that I did not cover here. Number 1, they are disgusting and I feel uncomfortable talking about them. Number 2, they are so numerous, this video would have gone on for 2 hours. And number 3, I didn't include a bunch of pictures because, quite frankly, I think they're triggering. I don't think that they have a place on this video. If you want to see those, you're able to go do your own research, but I don't think it's my place to just willy-nilly put those pictures out there. So I do want to say I did a brief overview of this case. I included a lot of the heavy-handed details, but if you are interested in this case, you can very easily find more minute details on the internet, and I will list all of my resources below so you can do your own little investigation if you wish. What I do want to say though before we leave is that women, particularly low-income and underserved communities, are easy targets for individuals who are willing to break the law and take advantage of individuals to gain money and status. And this is a place where the law really needs to step in and say something and do something and make sure that this doesn't continue to happen. I also think it's important, just as a citizen of the community, when you see these things happening, that we say something and do something. I'm not saying that it was very public or very well known that these sort of practices were going on at his medical society, but there's no way that individuals had not discussed some of these shady practices outside of the clinic. I do know that they had been reported numerous times and nothing had happened, and that is where the law really has to take an internal look and audit itself and say, what did we do wrong here and where could we do something different? With all of that being said, please let me know your thoughts down below. Thank you so much for joining me, and I really look forward to seeing you again later this week. I think I'm going to come back with another book video in the middle of the week because that's sort of stress relieving, and then maybe on the weekends I'll pop in with another true crime video. With all of that being said, thank you for joining me, and I will see you next week. I love you all. Have a great week. Bye!